USMLE style question on bronchiolitis. Question. A 6-month-old infant is brought to the emergency department during winter with difficulty breathing, cough, and poor feeding for the past 2 days. The mother reports that the child had a runny nose and low-grade fever before the symptoms worsened. On examination, the infant is tachypneic, RR58 min, has wheezing, nasal flaring, and intercostal retractions. Oxygen saturation is 91% on room air. Auscultation reveals diffuse expiratory wheezes and crackles. Which of the following is the best initial treatment for this patient? A. Oral dexamethasone. B. Nebulized albuterol. C. Nebulized racemic epinephrine. D. Supportive care with oxygen and hydration. E. Intravenous ceftriaxone. Answer and explanation. Correct answer. D. Supportive care with oxygen and hydration explanation. This infant presents with bronchiolitis, most commonly caused by respiratory syncytial virus, RSV. It typically affects children 2 years old, with symptoms progressing from upper respiratory infection, symptoms, runny nose, mild fever, to lower respiratory symptoms, wheezing, crackles, tachypnea, and respiratory distress. Management of bronchiolitis, mild cases, no respiratory distress, oxygen saturation 90%, supportive care, nasal suctioning fluids antipyretics, moderate to severe cases, respiratory distress, hypoxia, oxygen therapy, humidified high-flow nasal cannula if needed, hydration, risk of apnea in high-risk infants, e.g. preterm congenital heart disease, hospital admission. Why not the other choices? A. Oral dexamethasone, not recommended for bronchiolitis, as it is not an inflammatory airway disease like asthma or croup. B. Nebulized albuterol, not routinely recommended. Bronchiolitis is not responsive to bronchodilators like asthma. C. Nebulized racemic epinephrine, used for croup, laryngotracheobronchitis, not bronchiolitis. E. Intravenous ceftriaxone, RSV bronchiolitis is viral, so antibiotics are unnecessary unless there is suspicion of secondary bacterial infection, e.g. pneumonia, otitis media. Bronchiolitis equals RSV infection, most common in infants 2 years old. Presents with low-grade fever, nasal congestion, wheezing, tachypnea, and crackles. Treatment is supportive, oxygen if needed, nasal suctioning, hydration. No role for steroids, bronchodilators, or antibiotics unless another condition is suspected. Prevention: Palivizumab prophylaxis for high-risk infants, preterm congenital heart disease.